Director of the Institute, Dr. Helbi Sir, Dr. Shivanand Kumar, Dr. Bankhade Sir, Dr. Prashant. I am here to talk on particularly on the spread of coronavirus in the world. What are the geographical factors, its conceptual and its hypothesis, how it has spread it right from the beginning and what is the present situation. Now, if we find and look into that the coronavirus, the novel coronavirus disease is highly transmittable and pathogenic viral infection caused by severe acute respiratory syndrome to SARS-CoV-2, which emerged last year 2019 in Wuhan city, which was having population 7.54 million according to 2000 census, but now its population near about 11 million, located in the eastern part of China. It has since then caused a large scale pandemic and spread across the world. On December 31, 2019, Chinese authorities alerted the WHO of its outbreak, which was too late to mend, as by that time it has made its entry in many countries. The world novel indicates a new pathogen of previously known type of virus, and corona represents crown-like spikes on outer surface of virus. Therefore, it was named as coronavirus. It spreads to other directly, mainly by droplets produced due to coughing or sneezing of a COVID-19 infected person by being in close contact within 1 meter distance, especially when people do not cover their face on coughing and sneezing. These dangerous diseases can also transmit indirectly on touching one's mouth, nose, or eyes after touching any such infected surface or cloths. One out of every 6 persons who gets who gets COVID-19 can become seriously sick and develop difficulty in breathing, which can be treated only at district level hospital or above that. Now, if we look into the conceptual understanding of this social distance, which is generally used term by many people throughout the world, you can say, actually it is a physical distance rather than social distance. We are in need of maintaining the geographical distance to protect our well-being. At the same time, social isolation is not good for mental well-being. It is the geographical distance actually which is measured in meters or feet between two persons, and social distance explains the space between different groups of society such as caste, race, gender or sexuality. So this is actually the age of advanced technology where people are keeping connected directly with someone within or out of country is possible now. During the difficult times like this, the quarantine and isolation, we should remain linked virtually socially with our people. It can diminish depression and loneliness due to quarantine isolation of coronavirus infected person. So this is what actually that we have to keep or maintain the minimum distance of 2 meter or 6 feet from others while in office or in public or in market. But one has to restrict oneself to be in the market, or one can go once in a week so that you can minimize the visit to the public and in the public particularly or in the market, so that you can save yourself and others also from you. This is what actually the physical distance which we have to maintain. Now, if we look at the geographical uh, spread of this particular diseases, we can find that the outbreak of this novel coronavirus SARS-CoV-2 disease began in December 2019 in Wuhan. By March 25, 2020, the disease had rapidly spread from Wuhan to 196 countries located in different parts of the world. As of April 28, 2020, there have been a total of 3.12 million confirmed cases from all around the world. This contact transmissible has an average incubation period from 6 to 14 days. Fever, respiratory disorder, coughing, and shortness of breath are some of the early symptoms which in acute stage it can lead to death also. According to WHO, the first infected case in India was reported on January 30, 2020. Later, around March 4 onwards, it turned a major outbreak. Till today, as on today, Maharashtra is the leading state with a total number of 1,35,756 cases and death to 6,283, while the country recorded total COVID-19 cases 4,40,450 and deaths 14,015 on June 23, 2020. Physical distance, that is generally called by people as social distance, that has to be maintained, and mask on the mask and masks are the only measures adopted here in India. SARS-CoV-2 can be transmitted through various aerosols, large droplets, or direct contact with secretion to influenza virus. Virus transmission can be influenced by several geographical factors such as climate conditions, temperature and humidity, and population density. Outbreak is more severe in the countries located in the mid latitude where the temperature is considerably low in contrast to tropical countries. It is found that mean temperature, minimum temperature, and air quality had a significant association with the COVID-19 pandemic. Um, she et al. In 2020 has reported that a significant correlation between daily temperature and daily count of COVID-19 cases in China. It suggested that the temperature above 8 to 10 degrees centigrade would lead to declination of infected cases. Similarly, Prata et al. And some other people concluded that rise in 1 degree temperature would result in the decrease of number of daily confirmed COVID-19 cases in Brazil. So significant possible correlation between the number of number of cases with the SR, although no such significant correlation with the temperature and negative relationship with the rainfall are observed. Hot and arid areas in low altitude are required to strictly follow up preventive measures on an emergency basis. These are some of the geographical factors. Now, some of the dates where that, as I mentioned earlier, that this WHO alerted by Chinese, actually Chinese has delayed in declaring the spread of this COVID-19 in their own country, and although they have taken all steps to control within their country, especially in Wuhan, but one thing is that which we found from here geographical spread, that they have allowed the people to leave the country to other countries. That has caused the pandemic, that has caused the serious cause of concern, and it spread to other developed countries also, which they are suffering even today. So this is WHO alerted by Chinese officials about dozens of pneumonia-like cases in the city of Wuhan as New Year correlation and New Year celebration take place across the country. In particularly on January 1, United States Centers for Disease Control and Prevention CDS identified a seafood market in Wuhan suspected to be at the center of the outbreak. On January 7, it was found that China reports its first known death from an illness caused by new coronavirus. The patient was 61-year-old actually man in Wuhan. In January, particularly on 30th January, WHO further reported a case in Thailand, the first time it has been detected outside China. On January 21, the United States announces its first confirmed case, a man in his 30s in Washington state, in the United States itself. And thereafter, on January 23, China places Wuhan under quarantine. All flights and trains departing from the city are cancelled. They were cancelled. Buses, subways, and ferries within the city were also suspended. On January 23, again, WHO has mentioned the outbreak does not yet constitute a public emergency of international concern, and there is no evidence of human to human transmission outside of China. This was till January 23. WHO has not declared its epidemic or pandemic. Even in France on 24 confirms first two cases of the novel coronavirus. If we look at further, by the end of January, that is on 30th January, WHO declared the outbreak of a global public health emergency as more than 9,000 cases were reported worldwide, including 18 countries beyond China. So this is that on January 3rd, WHO declared that there is no emergency so far, but after 1 week on 3rd January, it was declared, looking into the seriousness of the spread of the coronavirus. Thereafter, February 2, the first coronavirus death is reported outside China. A 44-year-old man from Wuhan, actually, who died in Philippines. This actually continued in various other places also. On February 7, particularly, this is very important point to be noted here, that Dr. Li Ben Leong, who was particularly involved in checking the patient of COVID-19 in the very beginning in China. So that the Chinese doctor who issued a warning about spread of a new SRS-like virus before it was officially recognized, he died from the new coronavirus in Wuhan itself. That is on February 7, that doctor died. Further, on the same date, Dr. Li became a hero in China and his death sparked a wave of public mourning. On February 11, WHO announced the diseases caused the novel coronavirus will be known by the official name, that is COVID-19, which was declared as COVID-19 on February 11, 2020. It stands for coronavirus diseases that was discovered in 2019, which I have already mentioned about this. February 14, Egypt confirmed its first COVID-19 case, becoming the first country in Africa to be affected by outbreak. So there are so many countries which were also, even an Iranian minister appears ill at the news conference before being diagnosed with COVID-19. On February 20, 2020, United States of America announced additional travel restrictions involving Iran and increased warnings about travel to Italy and South America. February 29, the first COVID-19 death in the US took place. This man was of 50s in Washington state, which was recorded there. March 6, Trump signs an dollar signs signs 8.3 billion emergency spending package to combat the outbreak as the number of global cases hits 1 lakh. March 7, in Iran, one of the worst hit countries with 4,747 reported cases and 124 deaths, recently elected MP Fateh Meh Rabar dies from novel coronavirus. On March 9, all of Italy and its 60 million residents are placed under lockdown. March 9, Canada announced its first COVID-19 related death. The early man lived at North Vancouver nursing home. March 10, Lebanon and Morocco both reported the death from virus, while Democratic Republic of Congo, Panama and Mongolia confirmed first cases of the infection. March 11, WHO declared the novel coronavirus outbreak a pandemic. The pandemic which was declared on March 11. So this is actually the case. On March 16, closes its borders to most foreign travelers and imposes tough screening measures for visitors as number of cases in the country increased very high. March 16, on March 16, New York City Mayor Bill de Blasio orders cities, bars, theaters and cinema to close down as number of cases were rising in the United States. So these are some of the important dates. How South Korea also, but there are now some examples which could control. Even China could control immediately because Wuhan city was entirely locked down, and no one was allowed to go inside or from inside to go out. Therefore, that country could control this coronavirus spread at given time. But the other country, but mistake it has been committed, or you can say the care has not been paid, that the flights were allowed to go to other countries. Therefore, many people, those who were infected, they carried this COVID-19 along with and spread it to other countries wherever they have gone. That was the reason behind it, how it spread geographically to other countries from Wuhan. That is the origin of this coronavirus. Now we have to see that in India also there are so many problems. In fact, see, problems that in such a way that we have the number of cases which has increased at a very high rate. In fact, in India, as I mentioned earlier, that the number of cases today, we find that more than 4.41 lakh, that is 4,41,000. The deaths, more than 14,000 that has occurred so far today on 23rd of this June 2020. Recovery rate is quite high. In fact, 95% people are coming, hardly 5% or less than that the death rate is, because the people have a good immunity in India. They are exposed to different environmental conditions and therefore their immunity is strong. But the thing in Maharashtra, if we take an example of Maharashtra, Delhi, or within Maharashtra, Mumbai, Pune, the cases, number of cases are quite high. But now, in large cities, why particularly Mumbai, Thane, Mumbai, Pune, or Delhi, why it is so? Because these are the international airports, and people have come and they have gone back to their homes, and they have some were symptomatic and some were asymptomatic, and they were not that much checked, and those who checked and they had developed the coronavirus problem later on. But meanwhile, they have visited many places. They have gone to bank, post office, and their relatives, and they spent, and thereafter 3-4 days they were found that they were positive with this coronavirus. So that has made a reason to spread geographically from one to other human being. In fact, in Maharashtra, that is a very highly developed state. Per capita income is more than 1 lakh, but the thing is that the density of population is quite high. In the city like Mumbai, there are 67,586 cases were found on 23rd June 2020. Why it is so? Even in Delhi, 66,602 and deaths 2,301. Why these numbers, particularly the number of the COVID-19 cases, are more in large cities? People are exposed to this pollution, and they are having less immunity, and they are working day and night, and the density of population is very high, the fresh air is very less. So higher the density and lower is the immunity power, and larger the higher the chances of spread of this coronavirus are getting infected in the larger cities. And moreover, the where the humidity is very high, or you can find that the temperature is very low, in such places also we have found that it is quite high. But in the tribal areas, if we look into the data, in tribal areas or in northeastern, particularly Manipur. You can take Manipur, 921 cases, but there is no death. In Meghalaya, 46 cases of coronavirus, hardly one person has died. Nagaland, 330 cases so far, but hardly no one has died so far because of this coronavirus. Tripura has 1241, but only one person has died so far. But in case of UP, you can find UP, Uttarakhand, the cases are quite in large number. Even in Ladakh, cold area, but it's isolated one, there are 932, only one person has died. Goa, 9 beaches. Goa actually a very tourist place. 909 cases and 2 persons have died because it has controlled the traffic and no one is allowed to go inside and visit particularly now. Although tourism is affected and people are also not getting jobs there, that is the problem. Even this Lakshadweep, no case, neither there is no case of this coronavirus and no deaths. Question does not arise of death if there is no case. In Gujarat, it's 28,429, 1,711 people have died. Himachal Pradesh, 763, and 8 people have died. In Kerala, 3,451, 23 people have died. So this is what actually we find. But some of the countries, those who have got success in controlling, for example, South Korea immediately after getting this information and people started falling sick, they have started to lock down, and particularly lockdown in the sense that traveling from one place to another, from one country to another, they have stopped and they could control it. Similarly, in Taiwan also, they have done systematically and they could control much better way as compared to many other countries. Developed countries, Italy, for example, could not do like that. Even United States of America, most powerful country in the world, they could not do. So thing is that we have to put into practice that we have to wear the mask, we have to put the mask on our face, and as and when we go out, we have to keep minimum distance of 2 meters, that is 6 feet. If somebody coughs or talks, the droplets should not fall. If fall, we should be away from that and we should save ourselves and others also. So, and we have to wash our hands from time to time when we are going inside any store or any market. We have to wash, and from coming out immediately you have to wash, and when you reach home you have to wash your hands and change your clothes. In this way we can control this entire the process of this particularly spread of coronavirus. We can control ourselves, we can reduce the number of deaths, as well as we can make people healthy. But we have to do exercise, we have to eat better and fresh food, homemade food. For that, for example, you can have this uh, green tea in the morning, then we can have fresh fruits and fresh vegetables. It will increase your immunity certainly, and you will not fall sick and you will not become prey to the coronavirus. That's what actually I wanted to say about all this. Thank you very much.